always do it on this side. So I'm just right-handed, Miss Beth, so I'll do it this way. Essentially, you put your, see that space in there? Okay, so then you can do it. Other way around. Oh. Yeah, so there's a space right there in between the teeth where they won't bite you. And you can just slide it in there.
It's gonna go absorb.
Yeah.
Okay.
Yeah, it will. Yeah.
Yeah,
that's right. And I'll go down there and I'll. Sometimes they can be a little stubborn, especially donkeys. Yeah.
Oh, Tinker's she's the
then,
stubbornest.
Once she gets it in, you can go to the other side and kind of massage her tongue, and you see how she starts. And look, my finger's in this. It's called the interdigital space or interdental space. It's between these teeth and these big ones back here. And you can kind of pat her tongue, and then she'll lick for you.
Swallow it too.
Yep, she swallows it.
Try to get enough muscle to pull it back together and get the cover that job.
So there.
You need to be seeing this, Rick.
I want to show you this right here. Sorry.
No problem.
So even for her, if Tinker will take the hose, that's fine. You see this right here?
Yeah.
See that?
Squeezing that out, huh?
Right. So if you can squeeze that out, see how it's thick and kind of drippy?
Okay.
So it doesn't need to be like that. So even cold hose therapy on her little face is totally fine.
Okay.
Well,
Okay.
that spar and keep that moist enough that would come out.
I wouldn't, but see that right there?
Yeah.
I would just take your hands and just kind of do that right there.
Gotcha.
Yep.
Okay.
And the cold hose will make it fine. Now remember, we talked about this could come off. This may not live.
It may not.
So
yeah.
we'll
The skin may die off.
The
Okay.
skin may die.
Just peel clean off.
Right.
There ain't nothing to come.
I know how these go. We're going to take it, but see how this has got.
That has got really swole out, but I thought if we spray it with a hose, it might help get that infection out a little bit.
And so, like,
Or
see, I'm
pus.
trying to, like, pick off the crust, and they're hard. If you hose it, hose, like 5, 10, 15 minutes, that's the best way, okay?
Okay.
All right, so that's it on her. So
Okay.
and then on this one here, it's just like what Dixie's doing. Good 15. And like the other day when I was out here, I did it by myself. But even something like, you might get wet.
Don't worry about it.
Something like this.
Yeah, let me head.
See this really good force? So something like that, and just keep it, I was keeping it pointed away from her eye. And so you can even go up to something like that. So the easy formula is the solution to pollution is dilution. And literally this needs about as much water as we can do. And you can do this twice a day. That'd be great. Or you can just do it once a day. It's up to you. The bandage changes are what's gonna, how many times you want to bend. And then she's kind of got some crusties up under here. So just kind of easily massage that off once it's wet. And she's like even up in here she's got some. But you can tell, see that hole? See all this white?
Yeah.
And see this black? That all is probably gonna die. So you see that hole? We need to get down in that hole. So keep your nozzle, don't try to touch it. See this nice and pink?
Yeah.
Nice and pink? See the pink around there? See that? And see how if you keep doing it and working with it, it gets better and better. So pink, see how it's bleeding? This is perfect.
We want it to get some fresh blood flow in there.
We want it to bleed.
Yeah.
Okay? Does that make sense? It does, and it's applying nutrients too. So like if you know there's blood there, there's nutrition getting to the tissue. Does that make sense? Yes. So that is what you want. And don't be surprised if this, like, into this flap, you see this right here?
It's probably going to fall
I
off.
had that tacked. It was tacked up like that. It's probably going to fall off. I can fix stuff after we get it better. I can't fix it right now. So cosmetically, I can fix stuff. Right now, this is like the size, all that tissue in there, about the size of my hand. It wouldn't surprise me if it didn't fall out. There's nothing you can do.
Right.
I mean, that's just the extent of the injury. So just this for like at least 15 minutes on her face, if she'll deal with you. Frosted cookies, whatever keeps her interest. And I wouldn't give her those things until she started getting agitated. You see what I'm saying? That way we're not overdoing the treats.
Gotcha. Okay.
Does that make sense?
Yeah.
So like if she would eat her feed, that'd be great. But the problem is somebody may have to hand feed it because if her mouth's on the ground, this water is just going to keep going down into her feed pail, and she don't like it wet. We tried that already, so she doesn't like it.
So are you using this on their bottoms at all, on their rear ends?
The SSD cream, or what,
I meant
this?
the water therapy.
I have not, because it's either been, just one or two people or so, but you can just see how they deal with it.
Okay.
So in horses and stuff, like, just start on their feet and spray their feet and see how they do, and if they're okay with it, then move on up the leg. Does that make sense?
Mhm.
That's what you want to do. Hard and crusty, don't try to debride that or pick any of that off until you hose it for like 5 minutes. You want to soften these scabs up.
Oh, I gotcha.
Does that make
Makes
sense?
Yeah.
Yeah, so
Okay.
that's all. And if you have a really tough, nasty area, like over time, if something gets like if this were all crusted up from this draining and oozing, just take some Dawn dish soap, soap it up really good, rinse the heck out of it, and that way you make sure.
Take soapy water down
Yeah,
in the barn,
yeah.
warm and
Yeah, like a warm soapy. Yeah, that's fine. You just gotta make sure that it doesn't get the soap doesn't stay on there.
yeah.
And you can use gloves. The main thing is we're trying to fight infection by keeping it clean. So
Dawn's got some antibacterial stuff
yeah, and then what I'm gonna do is I'm gonna send you guys home because this is gonna take so long to heal. I'm gonna send you home with some of that SSD cream. Okay. It's just gonna be cheaper if you just buy a bucket. I mean, it's a little tub.
Okay.
And then once you get that area on the rear ends cleaned up, if you just want to put a very thin layer over it, it's fine. You can do that.
All right.
Wound over there. Focus here too. So see all this crust and scabs? Just when you get her home, just let that water flow and flow and flow and flow. And that will help take out some of that edema. The thing of it is in equines, when they hold their head low, they kind of, everything pulls.
Draining down?
Yeah.
Okay.
Yeah. So there's not much we can do about that part. So I heard that you guys got vet wrap, so you don't need that from us.
We got a bunch of vet wrap at R&J.
And you can either do vet wrap or you could do Elasticon or whatever. If you're doing vet wrap, I'll teach you a little trick. So this one hasn't been open per se. So what I do is I always unravel it. The reason you do this is so you don't put the bandage on too tight. Because especially where we're putting it around the neck, you don't want to put it too tight. You want to be able to breathe. And I know this looks time consuming, but do you see how much, there's a lot of force to me having to rip this off. So this is why I do this way. So you get it just to the end. Okay, you don't have to pull it off. Alright, so it's just to the end. Then what I do is I re-roll it backwards. That way it's ready to use when I go to put my bandage on. And it puts it on looser. That way I don't put it too tight on the patient. Does that make sense?
Yeah. And I did get a package of newborn diapers.
Perfect, yeah. And essentially, like it's literally like arts and crafts.
I just cut each one in half, maybe.
We'll see how big they are when we open them up.
To cover the wound. Yeah. And the biggest thing is if you needed to, say you put the diaper on, if somebody's not there to help hold it, if you could take, you could get you some medical tape it first, and then wrap it.
Well, the little neighbor that his house actually backs right up to my barn, Michael, he said he would be available all weekend to come help.
Oh, okay, cool.
And I'll check in with Dr. Lisa and Bill,
yeah.
too, and Bill might come out if Dr. Lisa tied up stuff at home.
So... And then this is the way we do it here. So your diaper's going to function like this gauze, okay? So it's the same difference.
Well, let me ask you this. He used something, hexachloride and IV, and he had, yesterday, Dr. Dow, he had pieces of gauze, and he just was cleaning down it.
Yeah. You can, it's fine, but honestly... if you want to take gauze and try, as this heals over time and you see the dead stuff sticking on there, you can take gauze and, use it to debride it.
Okay.
For ease of management, the easiest thing is going to be cold hose for, 15 minutes minimum, and then do this.
Okay.
So, and you're getting a whole tub of this.
Okay. Oh, good.
So this is, topically fighting infection, and it doesn't take much. And you can take a butter knife or you know, I'm
Yeah.
sure y'all are really creative, so perfectly fine. But you know, just kind of
And that also helps it not stick to the wound so
It
badly.
does. Yeah. Yeah. Oop. Yep. It does. Okay. All dirty. Alright. So once you get it all on there. There's that. And then this is where it's most likely going to take 2 people. And what I would do is I would just take a paper towel. You know, right now we're doing it for the day. You won't have to do it again. But take a paper towel or a regular towel, and you can just take it, pat out the water. You see what I'm saying?
Yeah. I've got a whole roll of paper towels ready to go down to the barn, so I set those out this
You got
morning.
that fat right. And then, you know, this is kind of just one of those things you just kind of figure out how you need to do it. I think the best ones that I've done, I started up here and just go right by the base of the ear and go above the eye. Okay. And sometimes I'll do that twice just because for stability. You can get as close as you need to the eye. Just make sure it's not hindering her. Make sure it's not too tight back there. And then what I do is I come down here. Start going around the face. Now it's important not to get this too snug. So you see how I can stretch it? So not too snug. It needs to just be tight enough to stay on there. And that's how come it takes so much. So see how that's going in her eye, and I just dropped it on down a little bit. Same thing over here. And then you can kind of use the tape if do y'all need a roll of this tape, or do you want to just see what happens at home? It's up to y'all.
What do you mean tape? You mean tape?
Yes.
Oh,
tape.
Like
actual tape. Okay.
Yeah.
Taping the end of it. Just tape
Yeah.
the end of it.
Yeah. So you can there's 2 ways
Well, I
you can
did
do
get
it.
a roll of that.
Okay.
Of
So
human stick to itself.
yeah, and
Ace bandage.
that's totally fine. Yeah, that'll work. And like this
Yeah.
works off heat.
Every time I cut myself, I'll just come down there and use that.
Okay.
I think maybe I have them because I was feeling.
I cut that one morning.
Maybe I get your right. Like you're on it.
I called
Chop
Dr.
you right
Miller.
off.
I
I said,
usually carry a pocket knife. These maternity pants about drive me
he
nuts.
said,
They
"Have
have
you
no
looked?" He said,
pockets.
"Yeah, I'm walking out the door."
And then too, what I found the other day is like after I do it this way, I thought I don't know how it
They said,
held up
"I'll
the
be there
next day.
in
Do you know
5."
the one that I did it like this?
But that grinder,
I
that
think
lady
it did
called
The
me.
racing stripe did pretty good.
Okay, that's what I was thinking. So just kind of like one of those nasal bandage almost, and then put it on her.
So she won't snore.
Yeah, so she doesn't snore.
About the time they come up the driveway,
And sometimes with these
right time,
tapes,
we
it
quit
just
sleeping.
takes the
Now, he
heat.
come and looked at it, and it had blood all over it. And he said, "Change them britches and bring it."
And I'll write,
Come
I'll
on
write
out
it
there, me and
down,
Davey
everything we
wanted
talked
something
about, and I've got it, most of it finished,
Loaded up.
and I'll email it to you today.
Okay.
Picked up a hammer and hit something and started bleeding.
And then too, just
I
like
had
no
to
halters
hold
or
it
anything
in
on
and
that
I
area.
I said, well, that's the end of
Yeah.
that. I just put it somewhere like that.
Do you need to get some of those, like, those ear tag things that you could just tie onto the bandage and that would be in proximity without having to put anything in?
So, yeah, so as far, I wouldn't use like cattle tags just because there can be some problems, like if they hit their eyes or get the medication from the ear tag on. Plus, every time you touch those tags, you have to have gloves on. Some people really break out touching those cattle tags, claw tags, so I wouldn't do that. They do have like some, we have some stuff that's called Patch On. I don't know if they would have it at the TSC or not, but like a wound, they have some wound repellent. Farnham used to make it, and it's they have a wound dressing or they have a fly repellent.
That's it, the purple stuff?
It's not purple. No, it's going to be an ointment. Do you know what it's? Okay, hang on. Let's get Google out here. Google everything. It's like a wound ointment.
It was just caking up in there, and it would fall right back out again. And I tried to get it behind her teeth because she looked like she was hungry. She just wasn't able to really chew very well. So I just thought that wound might just hurt her enough that she wasn't wanting to hold this on that. Hold the video, and I'm gonna go get a wet wipe for her. You can see a little bit of pus on there. Yeah, I see
So
it.
be real careful about
Yeah.
doing this, because like I'm at an increased risk of getting my finger. They can literally chew off your finger, like she could bite it in half.
I see what you're talking about
But
on that
I'm
side.
trying. So she has one. No. She has one little laceration right here, right there.
Yeah.
That's all right. That'll heal. And then up top, it's still holding. Here. Oh, thank you. It's
Get
still.
out some more. That's gonna be
That's all right. I mean, we can
two wash job. Oops, sorry.
So, yeah, let me go kind of clean off the.
Yeah, they got a shot yesterday.
Yeah, they're on something that'll last them quite like that. You want to put it in the least amount that you have to syringe in. Okay. Does that make sense? So enough to cover it up, but not so much that you're there all day syringing medicine in. So like, you don't want to do 60 mils. Try it with like 20 mils. If the medicine mixes up nicely in 20 mils, you're great.
A smaller amount, just it doesn't keep it up in there too long. Yeah.
Right, and the smaller amount I have to get them to eat medicated, the better off I am.
They might take that better in a smaller syringe than that big one. Huh?
Yeah, and I'll get you.
Say a 20 cc one or something.
Yeah, I'll get you guys some, and then that way you guys can figure out which ones you like better.
Okay.
I've
one
got
she
some
likes
big
better?
syringes they don't use.
Well, she's
I've got
gotta give
some
us a couple.
20s and I got some of the big
Yeah, and between everybody, surely we can find something that'll fit them. This is like Goldilocks, except on like a whole different level. So, all right.
I've had cows for 25 years. I've done a lot.
Yeah, hey, with one of the most frustrating things, and I've said this before, they've probably heard it. One of the most frustrating things that I've ever done and will continue to do is getting a baby calf to suck a bottle. Sometimes because sometimes they just waller it around, and you'll go to walk out, and then they just come up like, "Hey, I'm ready to nurse," and then you spent 40 minutes and they wallered it around. And then they come up to you and you stick it in right before you're ready to leave, and they suck down the bottle, and you're like,
what
okay.
I do to them? I get it, turn around and get their head up there and hold it up, and I take my finger and put it on the nipple of the bottle and hold it up and milk it. And after they get so much, they gonna swallow it.
Yeah, I mean, sometimes it is the most frustrating thing.
Stiff on me from doing
Yep.
that.
Yeah, I've got that whole
And then
bottle thing
later,
stiffness
after
going
that,
on.
they'll just grab that bottle and take off with it.
Yeah.
Like Rex does. Yeah, man.
Do you guys have anything else for me?
If I think I'll
You just let me know.
message you.
Sure. And
I
two,
think we're gonna be getting there and organizing and
that's the hardest part. It's just like me and my brand new baby. Organizing and getting all this down is the most frustrating thing.